Hello and welcome everyone to Ask My Doctor, an exclusive Q&A sponsored by My American Doctor, and we're honored to have with us Dr. Lalitha. Dr. Lalitha, how are you doing this evening? Oh, it's
I'm
morning for
very
you. I'm
well.
sorry, this morning.
It's okay. We are across the board, so it's okay. Good morning and good evening, everyone joining. Thank you, Ruhi, and thank you for having me.
Thank you so much for taking the time to be with us. Like, we value your insights so much. Thank you so much for taking the time.
Sure,
So, before we get into the questions, do you want to tell us a little about yourself?
sure. My name is Lalitha GundamRaj. I'm a neonatologist. I have been practicing neonatology for about 23 years. But I've been trained in pediatrics, and then neonatology is a subspecialty of pediatrics. Um,
Oh, what, Doctor, can you tell us more about what exactly is it that a neonatal doctor does?
Sure, yeah. So it is a subspecialty of pediatrics, like I said. So it is a 3 years of training, and it is truly called neonatal perinatal medicine. So as you know, babies are born without much of past medical history, like you hear about in medicine and adult or pediatric specialties. But in neonatology, we have to be trained to recognize maternal conditions or mother's conditions because that impacts baby's health, and we take care of. So that is one portion of our training and what I do. But also primarily the main chunk of my practice is primarily intensive care for newborn babies. So we take care of babies that are born as early as mid 22 weeks to almost 42 weeks of pregnancy and birth. Um, so um, so a lot of these babies, majority of them are premature, which means they are born under 35 weeks, or sometimes the 35 to 37 weeks are also called the late preterm babies. And they all come with a different set of problems, difficulties, or some things that we anticipate in those special brackets of prematurity. So some of them are more extreme, some are more we have better outcomes with some of them, but some and small portion of our practice is also babies who are born at term or post term but have some problem with transitioning after birth, breathing problems, feeding problems, or something that was not identified before and recognized right after birth. So it is all about pattern recognition, if you may, but it is more and it is also a teamwork. So a lot of NICU is nursing and respiratory therapy, and a lot of different care team is involved. A little portion, or about a smaller portion, is consultation also. So, for example, there is some identified high risk in during pregnancy, as early as possible or as late as it may be. As soon as the obstetrician finds a problem, sometimes they consult us to talk to the parents or mom that there is this problem, what to expect, basically what to expect. And sometimes it could involve other subspecialties in pediatrics, like cardiology, pediatric surgery, pediatric pulmonology, pediatric gastroenterology. As you know, we all have, there is pediatric subspecialties just like adult subspecialties, and they help us formulate a multidisciplinary plan for a baby as young um, as small as 23 weeks onwards. Okay, so sometimes we follow them throughout pregnancy because there is a variability and the progression may be different, or that is not following an expected outcome.
Mhm. Thank you so much, Doctor.